ये आपको डीएनए को आपको इन्फ्लुएंस कर रहे हैं. ओके, देन it is modulating the DNA and causing the transcription and translation, and there are different physiological effects. Okay, either through the testosterone or DHT. ठीक है, so the same thing is written here. Testosterone is binding with the testosterone receptors and this induces the RNA activity. So this testosterone pathway is mainly regulating the gonadotrophin secretion. Okay, and it is causing the muscle development also, anabolic action, जो आपको muscle mass होता है. Okay, it is also involved in that, and it controls the spermatogenesis. It influences the male sex drive and libido. Then there is DHT pathway. So 5-alpha reductase के बाद बनता है DHT. So after mainly it is active in prostate, scrotum, penis, skins and bones. Mainly it is responsible for sexual maturation at puberty and external virilization. Okay, एक simply अगर याद रखना है आपको तो external features के लिए ज्यादा क्या है, DHT है, external virilization, और internal genitalia के लिए testosterone है. But there are other things also like development of facial hair, skin changes. Okay, so there are different other functions as well. Enlargement of prostate, prostate का जो enlargement होता है, it is mainly due to the DHT pathway. इसलिए हम उसमें एक ड्रग देते हैं. जब आप आगे पढ़ोगे तो प्रोस्टेट इनलार्जमेंट के लिए 5-alpha रिडक्टेज का इनहिबिटर देते हैं, है ना. यू कैन अप्रिशिएट द फिजियोलॉजी कि टेस्टोस्टेरोन कन्वर्ट हो रहा है DHT में, और DHT क्या कर रहा है, प्रोस्टेट का इनलार्जमेंट करा रहा है. सो अगर हम 5-alpha रिडक्टेज को इनहिबिट कर देंगे तो DHT नहीं बनेगा, तो इनलार्जमेंट लिटिल बिट इट में सबसाइड, है ना, कम होगा. So we give 5-alpha reductase inhibitor, finasteride drug आता है. Okay, so there are some abnormalities which are associated with this phenomena, like one condition which is called congenital 5-alpha reductase deficiency. 5-alpha reductase का अगर deficiency होगा तो obviously what will happen, there will be absence of DHT, है ना. DHT बनेगा नहीं, है ना, बनेगा नहीं ना. So what will happen, it will cause confusing genitalia, external features ठीक से develop नहीं होगा. Okay, so what will happen at birth, the वो क्या होगा, child will be supposed to be a girl. Okay, so external features नहीं आता, male internal genitalia but female external character. Okay, so what will happen, it is a cause of male pseudo hermaphrodite. Okay, internal genitalia is male but external features is not male, female. Okay, opposite sex का, and in this case the testis will not descend to the proper position. Okay, so DHT is also involved in that. Okay, so undescended testis is a common feature in this condition. Okay, and but however what happens that as the child when it grows at puberty, उस टाइम में क्या होता है, LH secretion increase होता है and it increases the testosterone secretion, it increases. Okay, but what happens that they are increased at puberty, so what happens that later the subject starts developing the male features. Okay, so that's why they are called, they are penis at 12 syndrome. Okay, what happens that the clitoris starts enlarging after attainment of puberty, and what happens that in this age the subject usually changes his gender. क्यों आ रहा है अभी बेटा? Why are you coming? Go. So that is called penis at 12 syndrome. Okay, so that is the another condition due to congenital 5-alpha reductase deficiency. Then another condition I was telling you, that prostatic enlargement, prostate hypertrophy. Okay, and DHT, as I was telling you, it is involved in the induction of prostate enlargement. Prostate को क्या करता है, hypertrophy कराता है ना, prostatic enlargement में. So what happens that the drugs that inhibit that enzyme 5-alpha reductase, they are used in the treatment of this condition. This drug, finasteride and diasteride. Okay, dutasteride आता है. Okay. Then coming on to the physiological actions of testosterone. So you all know testosterone is involved in the Wolffian duct stimulation, Mullerian duct suppression, isn't it? Stimulation of Wolffian duct leading to the formation of male internal genitalia. Then it stimulates, all of you know, it stimulates erythropoietin secretion from the kidney, isn't it? So it stimulates the erythropoietin synthesis, and also it stimulates bone marrow activity. Erythropoietic activity को बढ़ाता है, and it increases the muscle mass. जो muscle protein है उसको synthesize करता है. It is having an anabolic action on protein, so it will increase the muscle mass. Okay, and moderate retention of sodium, potassium, calcium, water, different electrolytes, and also it stimulates the bone growth. And spermatogenesis में involved होता है. Okay, then it stimulates the androgen binding protein also from the Sertoli cell. Sertoli cell से आते हैं ना, so it is also involved, stimulate the synthesis of this androgen binding protein. Male vigor and libido. So as I was telling you, DST is the most potent. After that, testosterone, then androstenedione, then dehydroepiandrosterone. Okay, so this is the potency wise order. So coming on to the different action in the brain, you can see it is involved in the confidence, memory, increased libido, and also the increased mood, better mood. Okay, if the testosterone level is low in male, what is happen? Patient loses confidence. Okay, and he will become lethargic, decreased memory. Okay, so it is involved in this important function. After that, in the bone marrow, the RBC production, it stimulates the erythropoietic activity in the bone marrow, then increases the bone density. Okay, increases the strength of bone, osteoblastic activity is increased. Then in the muscle, it is having a anabolic action on protein, so it will increase the muscle growth, increase the strength and endurance. Okay, then you can see in the kidney it increases the erythropoietin release, and in the sex organs it is involved in spermatogenesis, erectile function, okay, erection of the penis, then prostate growth, seminal vesicle growth, penile growth. Then skin, so it increases the body hairs, especially the beard area, but there is recession of hairs on the scalp in male. Okay, and there is increased toughness of the skin due to increase in collagen growth. Voice का changes होता है. So these are all the functions of testosterone as a whole. Okay, development of secondary sexual characters we have discussed. Okay, that is the external and internal genitalia, body hair, skin changes, mental growth, we have all discussed in the diagram itself. Musculoskeletal changes, same thing must be written here. Penile enlargement, scrotum become rugose, pigmented, internal genitalia. Okay, they will increase seminal vesicle, prostate gland, their secretion will increase. Growth and distribution, male pattern of growth of hairs. Okay, that is called. And sexual hairs, the hairs on the scalp will recede in male, so baldness is considered as a sign of maleness. Okay, so skin changes, in general skin becomes rough, okay, due to the increased collagen synthesis. Then the subject will become more active, increased libido, increased memory, increased confidence, we have all discussed. Then voice changes will be there, body configuration, height spurt, okay, then male features, broadening of the shoulder, the all will be happening. All the secondary sexual characters will be developing. Then the other hormone, that is the testicular estrogen. बैठ जाओ please. You all three sit down. So the testicular estrogen, the main estrogen is the estradiol. The lesser amount is the presence of estrone. Okay, the plasma estradiol level in male is 20 to 50 picogram. Okay, and in male only 15% of this estradiol is coming from the testis. And from where the other forms are coming? They are coming from the aromatization. Okay, testis से directly अपना synthesize हो रहा है estrogen, and rest of it is coming from aromatization as well as from the adrenal area. Then the action of estrogen क्या होता है? We have discussed what is the action of estrogen in male. In the previous class we have discussed. Yes, very good. So there is presence of estrogen receptor in the, कहाँ पे होता है? Rete testis area, and that causes absorption of excess fluid. अगर ये नहीं रहेगा तो क्या होगा? Absorb नहीं होगा तो the potency will be decreased. Okay, ये diluted हो जाएगा. And also it helps in the bone. Bone में क्या होता है आपका? जो height होता है, okay, उसको bone growth में ये help करता है. Okay, epiphyseal closure, epiphyseal जो plate होता है उसको close करने में help करता है. It is involved in that. So epiphyseal closure, it limits the increase in height. Then estrogen receptors is present in rete testis, in fluid. It causes the fluid reabsorption, and it also provides the feedback, negative feedback में help करते हैं, gonadotropin release. Then other testicular hormone. Apart from this, there are hormone that is called inhibin, then activin, then follistatin. Little bit about them also. Inhibin, you know, it is coming from the, ये ovary से भी आ रहा है, inhibin release हो रहा है, also from the Sertoli cells, दोनों आ रहा है, and it is inhibiting the FSH release. Okay, ये FSH release को mainly ये regulate करता है ये. So Sertoli cells से आ रहे हैं, and also granulosa cells of ovaries. Two types of inhibin are there, A and B. Okay, so it inhibits the FSH secretion from the anterior pituitary. It regulates the FSH release. In that way, it is regulating the spermatogenesis as well, isn't it? And oogenesis. Then activate, ये activate करेगा, FSH release को बढ़ाएगा. Okay, so activin is also produced by Sertoli cells, and it stimulates the secretion of FSH. वो कम कर रहा था, ये increase कर रहा है. Okay, and there are different combinations, sub units होते हैं, उससे बनता ही है. Mainly, it also stimulates the WBC development. Okay, leukocytosis करता है in the bone marrow, and formation of mesoderm during embryonic life, and the gonadal development. Follistatin, it inactivates the activity of activin. Opposite है ये. So FSH secretion will be decreased, isn't it? ये activin को inactivate कर रहा है. So FSH activity को कम करेगा. Okay, and obviously it will influence the spermatogenesis because FSH influence करता है spermatogenesis को by a paracrine mechanism. So ये आपको hypothalamic pituitary gonadal axis है. You can see Leydig cell से आ रहे हैं testosterone, ये negative feedback दे रहा है, and also inhibin B especially here, and it is giving a negative feedback. Then coming on to the some abnormalities related with this, that is the most important abnormality is the अगर testosterone कम होगा secrete, what will happen? Undescended testis, isn't it? That is cryptorchidism. Failure of migration of testis from abdominal cavity to the scrotum. Okay, किस week में scrotum में आता है ये? 33 weeks. Okay, 33 weeks में ये scrotum में आ जाता है, into the scrotum during the fetal development. If it is during somewhere during this passage, you develop okay एब्डोमिनल कैविटी से आ रहा है नीचे, कहीं पे भी ऊपर रह गया, दैट इज अनडिसेंडेड टेस्टिस. मोस्ट कॉमन इज द दिस हाई स्क्रॉटल, मतलब इंग्वाइनल कैनाल में लेकिन नीचे में है. ओके, हाई स्क्रॉटल, स्क्रॉटम से ऊपर है, इट इज द मोस्ट कॉमन. देन दिस इंग्वाइनल कैनाल, देन एब्डोमिनल. ओके, सो व्हाट इज द ट्रीटमेंट, क्या होगा इसका फिर? Obviously we can give some testosterone from outside, isn't it? So this is the feature क्या मिलेंगे इसमें? Seminiferous tubules will be, it will be immature, infantile. So seminiferous tubule infantile, क्यों रहेगा infantile? Spermatogenesis will decrease. Why is it so? Because temperature body का हमारा abdominal cavity का ज्यादा होता है ना? If there is increase in temperature, the spermatogenesis process will decrease, and it may cause sterility due to higher temperature. And Leydig cells, but Leydig cells will remain normal and continue to secrete testosterone. So male secondary sexual characters develop. Okay. The treatment, you can give gonadotrophin hormones from outside, facilitate the descent. Okay, gonadotrophin हार्मोन दे सकते हैं, एंड ऑल्सो ऑर्किडोपेक्सी करते हैं, ऑर्कियोपेक्सी कहते हैं. ओके, दैट इज सर्जिकल करेक्शन. अगर हार्मोनल ट्रीटमेंट फेल होता है तो सर्जिकली करेक्ट करते हैं. ओके, अनडिसेंडेड टेस्टिस, ऑब्वियसली इट विल डिक्रीज द टेम्परेचर एंड समटाइम्स इट में कन्वर्ट टू मैलिग्नेंसी. ओके, टेस्टिकुलर ट्यूमर भी हो सकते हैं. In undescended testis में testicular tumor, prevalence of testicular tumor is high. Then there is another condition, that is male hypogonadism. Okay, male hypogonadism मतलब क्या हो गया? टेस्टोस्टेरोन इससे भी कम हो रहा है, hypogonads, gonadic function कम है. Okay, so there are two types of male hypogonadism, that is hypergonadotrophic हाइपोगोनाडिज्म, मतलब गोनाडोट्रोफिन तो ज्यादा है. ओके, लेकिन क्या है? टेस्टोस्टेरोन लेवल कम है. हाइपरगोनाडोट्रोफिक बिकॉज व्हाट इज हैपनिंग दैट टेस्टिकल्स में अगर डिफेक्ट है तो वहां पे क्या होगा? पिट्यूटरी और हाइपोथैलेमस ठीक है, तो क्या होगा? टेस्टोस्टेरोन कम होने से क्या होगा? निगेटिव फीडबैक से एलएच और एफएसएच का सिक्रीशन बढ़ा देगा. दैट इज कॉल्ड हाइपरगोनाडोट्रोफिक हाइपोगोनाडिज्म. ओके, अगर ये सेंट्रल काउज है या पिट्यूटरी में डिफेक्ट है या हाइपोथैलेमिक डिफेक्ट है, सो इट में कॉज हाइपोगोनाडोट्रोफिक हाइपोगोनाडिज्म. टेस्टोस्टेरोन भी कम है और सेंट्रल काउज है, इधर इट इज इन द पिट्यूटरी ग्लैंड और इन द हाइपोथैलेमस, दैट इज हाइपोगोनाडोट्रोफिक हाइपोगोनाडिज्म. सो द सेम थिंग which is written hypergonad, if hypogonadism occurs due to testicular dysfunction, then gonadotrophin level will increase. If mainly in the dysfunction of the hypothalamus or pituitary, then there will be hypogonadotrophic hypogonadism. So before puberty, अगर puberty से पहले, if you remove the testicles, what do you think so it will happen? Though no development of any secondary sexual characters, isn't it? And that condition is called, genitalia are usually small, all the external features will be depressed as well as internal features, that is called eunuchs कहते हैं, eunuchoidism. Then androgen secreting tumor, if there is hypersecretion of testis, if it is usually due to tumor in the testis में tumor हो जाता है, that is called Leydig cell tumor होगा तो क्या होगा? That is called precocious puberty, early puberty, isn't it? So there are some questions which is related, which we have covered from the initial classes. So can you answer these questions? Full development and function of the seminiferous tubules requires somatostatin, LH, oxytocin, FSH, androgen and FSH. What is the best possible answer? Yes? A, B, C, D. कौन सा? D. E. Yes, yes, correct. E is the best appropriate answer. Androgen and FSH. You require both these. Then next question. Testosterone is produced इधर देखो, कैन यू आंसर? टेस्टोस्टेरोन इज प्रोड्यूस्ड, यस, ए बी सी डी, सी, व्हाई डू यू थिंक सो? सी, ए बी सी डी, ए से जेड तक आते हैं तुम्हें बेटा, ए बी सी डी नहीं करना, तुम्हें पता होना चाहिए। टेस्टोस्टेरोन इज प्रोड्यूस्ड, दिस इज द बेस्ट पॉसिबल आंसर, B is the best possible because the precursor molecule, cholesterol and pregnenolone, you can understand. Okay, obviously it is coming from the Leydig cell, but if there is best possible answer, you have to appropriate, choose that one. Can you answer this question? Little bit difficult, but we have discussed at some point of time. NOS क्या है? NOS, nitric oxide synthase. Nitric oxide synthase. Nitric oxide helps in erection. B. वो तो तुक्के में कुछ ही बोला तो कोई ना कोई सही हो जाएगा. But you have to give the logic. Why is it C? खड़ा हो जा. हाँ खड़े हो जा. खड़ा तो हो. क्या होता है? NOS क्या है? मैं बोला बैठने के लिए आपको, हाँ? C is the correct answer because what happens that NOS, it activates the guanylyl cyclase, it increases the CGMP level. CGMP level increase होगा तो vasodilation होता है. Okay, so it increases the, relaxes the smooth muscle and increases the blood flow. Okay, this is the best possible answer. Okay, और सिल्डेनाफिल जो टैबलेट्स आते हैं आपको बताया था, है ना, वो फॉस्फोडाइस्ट्रेज एंजाइम को ब्लॉक करते हैं फॉर द रिएक्शन टू हैपन. बट हियर दिस इज द बेस्ट पॉसिबल आंसर. एंड लास्ट क्वेश्चन, ये तो बहुत इजी है. इट इज ए आंसर हो जाएगा इसमें, है ना. तो थैंक यू सो मच.